for giving us this time to present today. We're going to talk about the impact of immobility in the COVID environment and the importance of mobilising patients and doing it safely for both patients and for the staff. So even before COVID hit, the synergy between immobility and falls and cognitive impairment and incontinence were already a big problem. And especially in the long-term care population, what we know is that when patients are immobile, they lose muscle strength every day. Their cognitive function declines every day. Their reflexes get a little bit slower and their impulses get a little bit more erratic. So even though the challenge of mobility is even greater, the importance of it cannot be overstated. And then we add to the trifecta, if you will, we add the social isolation. And we know that patients who are isolated, we know they have more anxiety. We know that they are at higher risk of depression. We know that patients with dementia are going to have more symptoms when they're isolated and they are not socially interacting. So the challenges with isolation make it even more difficult. Add to that the perspective of the caregivers. There are a lot of staff, of nurses particularly, who unfortunately are getting burned out and are leaving nursing or leaving the bedside in this COVID pandemic. There are studies that show the burnout rate and the anxiety and depression among our caregivers is higher than normal. Add to that the fear of them taking coronavirus back to their own families. And we know that on the statistics, there are about 400 nursing home caregivers who have died since the beginning of the pandemic. So the fear is real. And so the challenge we're faced with, and I know that all of you are dealing with this same challenge in one way or another, whether you are a caregiver, whether you are a direct frontline worker, or whether you're on the administrative side of things, and you're looking at how this is impacting the bottom line, this is a big challenge wherever we are. So what we're going to do today is we're going to show you through videos, through working with patients and simulated patient cases, how you can overcome the challenges. You can still achieve mobility. You can still achieve meaningful activities. And you can do it in a way that is engaging for the patient and keeps both the patient and the caregiver safe.
Some of our scenarios include older pre-COVID videos before masks were mandatory. We do this to show a variety of ways that you can build mobility into your daily nursing care. Our goals are to engage the residents, to perform safe activities that are meaningful and fun for the residents wherever possible. Beginning with bed mobility, if patients or residents need assistance turning anyway, use a repositioning sling with a ceiling lift to perform the lifting that would otherwise be done with a second care team member. The resident can be encouraged to participate as much or as little as they are able. Proning has become especially frequent during COVID-19 as a position to improve oxygenation of the lungs. A combination of a ceiling lift, a repositioning sling, and friction-reducing devices to position the patient in the center of the bed as they roll allows this activity to be carried out safely with fewer staff and fewer sets of PPE. The same repositioning sling can then be used to assist a resident who is dependent to sit safely at the edge of the bed. We can build mobility into this activity by having the resident help walk their feet to assist with turning from one side of the bed to the other. This helps engage the resident at the same time maintaining or improving strength in their legs. Another option for sitting at the edge of the bed is a seated sling. Even if the resident is very weak, sitting up stimulates the brain and the circulatory system and helps give them a sense of hope and participation in the activity. Pairing the ceiling lift, seated sling, and a friction-reducing device allows in-bed walking as much or as little as the resident is able to participate. Again, this helps keep the legs strong and can be done safely even with larger residents who require a lot of assistance. The key is to let the lifts do the lifting portion, protecting both the residents and the caregivers from potential injury. The resident feels like they are active members of the care team, which gives them hope and also feeds into their dignity to help in their recovery. The friction-reducing device prevents shearing under the resident's buttocks and allows them to help boost and reposition themselves in a way that includes active mobility without the skin shear. You can even build in a little ab workout by asking your resident to sit up from just a slightly reclined position. Next, we move to assisting a resident to get out of bed, to sit in a bedside chair, or to get onto a commode for toileting. Notice the hanger bar being used is a 4-point flexible hanger bar as opposed to the 2-point or 4-point fixed bars that are commonly seen in ceiling lifts. Vancare's unique design allows the hanger bar to self-correct so that with resident movement, or if the caregiver does not hook up the straps of the sling exactly symmetrically on each side, the self-correcting mechanism will keep the resident centered and comfortable. This is especially important for residents who have dementia or impaired cognition. Notice as the resident moves in the sling, the hanger bars move with them. Vancare seated slings also have handles in the lower back area, which allow the caregivers to position the resident further back and in a more upright position in the chair. Although this type of bed egress is not common in long-term care and is more frequently seen in acute care and ICU, a ceiling lift and ambulation harness can still be used to safely assist the resident off the bed and onto a commode or to the bathroom. Even if the resident is weak, they will not fall and can actively participate in walking with as much or as little support from the lift as is needed. Let's watch how Chris can safely be transferred to a chair using a floor-based powered stand aid. Vancare's bariatric powered sit-to-stand lift can lift a resident up to 800 pounds. And is unique among the sit-to-stand devices because of the extra wide knee pads and footplate that accommodate the wider stance adopted by patients of size. Encourage the resident to participate by trying to beat the lift to standing and by reaching behind them for the chair as they sit down. An alternative way to assist Chris to stand up is by using a ceiling lift with an ambulation harness. Once Chris reaches a certain point, he is able to stand the rest of the way on his own. This video shows Chris in an ICU environment to demonstrate that even with lines, tubes, drains, and on a ventilator, the patient can participate safely in his own mobility. Notice that the nurses do not have to do any of the lifting. Had a seated sling been used to passively lift Chris back to bed, he would not have had the opportunity to work his muscles and participate in the activity. Chris is now able to wash his own face at the sink. This normal morning and nighttime routine is especially important for residents with dementia or cognitive impairment. Manually lifting or transferring Chris back to bed would have put the caregivers as well as Chris himself at high risk of injury. And leaving him in bed would have led to further weakness and debility as discussed earlier. Notice that Chris's knees buckle as he is walking back to bed. Had Chris actually fallen, this activity and the following course of care could have looked much different. But by using the safety equipment, everyone is safe. confidence is preserved, and Chris successfully engages in his own daily care. The hardest part of standing up for residents from low chairs is the beginning of the movement. Their weight is all the way at the back of the chair and their legs are not in a good position to help them stand up. As the powered stand aid brings them forward and upright, often they will be able to help once they reach a certain point. Encouraging them to do this helps build mobility into transfers on and off the commode or toilet, or into or out of the bedside chair. The powered stand aid with footplate attached is a good option when the resident is non-ambulatory and still allows them to bear weight through their legs and be upright. Even if they have some ability to ambulate, if they are urgently needing to go to the bathroom, transferring them using this device helps them get to the toilet faster and successfully void their bladder. This helps preserve continence as well as dignity for the resident. If the resident has more strength and just needs a little help to stand up, then a non-powered standing aid will be appropriate to use. As for the powered stand aid, you can have the footplate on to wheel the resident to the bedside chair or commode, or to the bathroom, or you can remove the footplate and have them walk with the safety of the knee pad and the seat behind them in case their knees buckle, or if they get too tired to keep walking. You can build mobility in by asking the resident to help lift and lower the flaps behind them, perform their own pericare after toileting, pull up their own pants, and even have them stand up or sit down a few times in the stand aid to help build up their strength and their balance and endurance. The additional challenges brought on by the coronavirus have made it more difficult to find activities that are fun and meaningful to our residents. This is especially true for those residents with impaired mobility. Chris loves to play basketball. If he is unable to join others or cannot leave his room, we can use an over-the-door basketball hoop. Chris is demonstrating poor balance and high fall risk. His size and his fall risk do not need to limit his activity when he is in an ambulation harness and attached to a ceiling lift. Clearly, Chris is very comfortable hanging out in the harness. We can encourage further strengthening by motivating him to stand up and walk rather than just hanging out. Sharon is fairly mobile. She just has poor balance with turning, or if she tries to do two things at once. She startles easily and has difficulty bending to get things from low shelves or surfaces. We can work with activities of daily living in restorative nursing, as well as physical or occupational therapy, to do more challenging activities, even when patients have high fall risk. Our patient Sharon is able to bend over and retrieve a basin from a low cupboard under the sink. The lift can help her stand back up if she is too weak to do so on her own. The harness and ceiling lift support allow us to give her more time to perform activities if she tires quickly or needs support. As we saw when Sharon was in the standing bed, we could use this same setup even if she was more dependent and needed a lot more assistance. Again, to note is that the resident is safe even if she loses her balance, and the caregiver is safe. The activity is meaningful and helps restore Sharon's strength and her independence in daily activities and self-care. Restrictions on visitation has taken a significant toll on nursing home residents. Visits outside of room windows is highly recommended. Imagine the added joy that can come from a resident not only seeing a loved one outside from their wheelchair, but being able to interact standing up. Consider for the resident the difference between watching from their wheelchair, unable to participate, versus being up close and high-fiving their grandson. Also consider the impact on the grandchild or the loved one doing the visiting. To see a smile, to see their loved one standing, walking, high-fiving, even if they are off balance. The quality of the interaction is magnified tenfold, and hope and joy can help combat some of the isolation. Another consideration to help reduce the exposure, and the number of the residents exposed to COVID-19 is to seek mobility solutions for transition to home environments. Impaired mobility is one of the main factors preventing residents from being able to live at home. The Van Move is a non-powered stand aid with seat behind and removable footplate that can be used either in institutionalised care or at home. It can allow the resident to access surfaces, cupboards and sinks, empowering them to participate in activities of daily living to the greatest degree possible. One of the challenges with home care environments is tight spaces and hallways and small bathrooms. The Van Turn is a great solution to assist with toileting when mobility is restricted in small spaces. Here we see Sharon holding on as she is wheeled to the toilet. This device does have a belt that can go around her buttocks to give her further support, and knee pads prevent her knees from buckling. The small footprint allows us to access tighter spaces, and Sharon can pull herself up, she can wipe herself, manage her own clothing, and she can do all this safely without the fear of falling. So in summary, we know that mobility impacts falls, cognition, continence, and psychological well-being. We know that mobility can be performed safely for both residents and caregivers by using safe patient handling equipment. We can also reduce the number of caregivers needed to safely perform meaningful activities. And we can make activities fun, even in isolation, and even for residents with low mobility. We appreciate your time watching today, and we would love to take a few minutes to answer any questions that you have.